About 422 million people are affected with this disease worldwide, and 1.6 deaths are attributed to this disease. What am I talking about? I'm talking about diabetes mellitus. Hi, it's Dr. Mayura, and I'm going to be talking about diabetes mellitus. Diabetes mellitus is a global epidemic, and it's imperative that we educate ourselves about it and learn more about it. Its complications are lethal and can include things like blindness, heart attack, stroke, end-stage kidney disease, and lower limb amputation as some of the complications of this disease. So what is diabetes mellitus? Diabetes mellitus is a metabolic disease which results in high blood sugar. And why does it result in high blood sugar? Because there is either no insulin produced in the body, or the insulin produced is not being effectively used in the body. So let me go through the three types of diabetes mellitus. There is type 1, type 2, and type 3. So type 1 diabetes mellitus is also called juvenile diabetes mellitus or insulin-dependent diabetes mellitus, and it is present in approximately 10% of individuals. The rest 90% have type 2 diabetes mellitus. So type 1 diabetes is, what is type 1 diabetes? It is an autoimmune condition, a type 4 hypersensitivity reaction, where the body does not produce its own insulin. So there are cells in your body which are attacking the beta cells in the pancreas. The pancreas is an organ which has beta cells which normally produce insulin to shift your glucose into your cells so they can be used. But here there's no production of insulin, or it's very, very depleted. So your own body is doing this. So it's an autoimmune condition. So it needs to be treated by supplementing exogenous insulin along with lifestyle and diet. Now, type 2 diabetes mellitus is the 90% of people have this disease, and it's everywhere. So in type 2 diabetes, what happens? Basically, and type 2 is also called mature onset or non-insulin dependent diabetes mellitus. Here, the insulin receptors are resistant to allow glucose to come into the cell to be used as energy. Because what happens is, when we eat a meal, we eat a carbohydrate or high sugar rich meal, our body, it goes to our digestive system, our stomach, and then it becomes glucose and it goes into our bloodstream. Now, our cells need glucose to survive because they need ATP for energy, and they use glucose for this. So just like a car needs to run on fuel, our body runs on energy and ATP. So glucose is the primary source of energy that we use, and without glucose, without a proper utilization of glucose, we'll be cutting into other reserves in our body like fat. So the complications of high blood sugar. So there's high blood sugar there's high blood glucose in your bloodstream, and so this is the complication, and this is the symptom of diabetes. But the root cause of diabetes is the insulin resistance, which I'm talking about type 2 diabetes. Now, type 3 diabetes is called gestational diabetes mellitus, and it's present in pregnant mothers who are going to have children. So you have to be careful about this if you're overweight, or if you've had a previous pregnancy of gestational diabetes, or you have a family history of gestational diabetes. And about 18 out of 100 to-be moms get gestational diabetes. And this is so concerning because this can cause problems with the child, the in utero. So the high blood sugar running in the maternal bloodstream causes issues and complications with the child, and you'll see them at birth. You might see a large baby, but there are other complications that you see later. So these are the three types. So let's go into the symptoms of diabetes. Now, how do you know you have diabetes, right? How would you be aware that you have diabetes? What are the symptoms to indicate that you have diabetes? Well, unfortunately, the early symptoms are not many. And that's why people either go when they have end organ damage or very late, or people get, a general health checkup, and they see they have high blood sugar on that. So it's important, I think, to have a general checkup and do a blood test and measure sugar every 3 to 6 months. I think at least a sugar monitoring, especially if you have risk factors and family history, or you have a very inactive sedentary lifestyle and a bad diet. So it's important to keep checking these things, not to let this disease progress, because this disease is reversible. It is absolutely curable with a proper diet and exercise. It is curable. There are many cases where people have been on multiple medications and even 100 units or even 300 units of insulin and have lost weight by being on calorie deficit diet and a specific diet with intermittent fasting, and have stopped all their medications, and their levels of sugar have come down drastically. So have hope and faith that it is in your hands to cure this if you have it, instead of being on multiple medications. And so the symptoms are, which if you do notice, there'll be polyuria, polydipsia, and polyphagia. So polyuria is you're urinating more frequently. Polydipsia is you're more thirsty all the time. And polyphagia is you're more hungry all the time. Also, you'll have glycosuria, which is glucose in the urine. You will also have either you have excessive weight gain or you have weight loss. And these changes in weight can also be attributed to diabetes mellitus. Also, blurred vision is one of them. And women can have yeast infections, vaginal yeast infections. And why? It's because there's a lot of sugar, the excess sugar in the bloodstream is not being able to be filtered by the kidney and is coming out in the urine. Men can have yeast infections. So these are some of the symptoms. And of course, there are vague symptoms like nausea and sometimes vomiting and being fatigued and irritable. So all of these symptoms are symptoms of diabetes. And when you think you have these symptoms, or in my opinion, before you have these symptoms, and when you have risk factors for this, like a sedentary lifestyle, a family history, or your age is more than 45 years old, or you've had you're eating a lot of sugar in your diet or carbohydrates in your diet, or you have PCOD, or if you're a particular race, these all predispose you to having diabetes. And African Americans have the highest rate of diabetes, and Hispanics and Asians more than Caucasians. So we just need to be aware of this, and we need to be vigilant and proactive. So how do you now, what is the diagnosis? How do you diagnose whether you have diabetes, right? So you go to your doctor and he will order a couple of tests. So he orders a fasting blood sugar. So that's when you fast the entire night. You can drink some water and go in the morning to the lab and get your blood tested. So here you will see if you're fasting, the normal fasting blood sugar is 70 to 100. From 100 to 125, you're pre-diabetic. You need to be careful. And 126 and above, you're diabetic. Now you can also do a postprandial or random blood sugar. So if you're between 70 to 140, you're in the normal range. If you're between 140 and 200 milligrams per cent or milligrams per deciliter, you're pre-diabetic. And if you have postprandial blood sugar of over 200, then you are diabetic. So these are some of the tests that can be used. There also there's a very, very, very important test that's being used everywhere now, which is called HbA1c. It's called glycosylated hemoglobin. So in your blood, when you have excess sugar and glucose, the glucose attaches to the hemoglobin molecule on the red blood cell, and it stays there. And so it can measure, that is a average measure of the 3-month blood, your 3-month blood sugar. So it can show you if your blood sugar has been elevated for about 3 months and the changes. So you normally do this every 3 months if you're a diabetic. So now if you have an HbA1c of 5.6 or less, you're okay, you're normal. But if you have a HbA1c of 5.7 to 6.5, you're pre-diabetic, and if it's over 6.4, and if it's 6.5 and above, you're diabetic. So I think pre-diabetic individuals have to be very careful. They can actually not go into a stage where you need diabetes, and you just have to manage yourself with lifestyle. You just have to change your lifestyle. So these are, the tests to diagnose. Now for type 1 diabetes, there are more tests because it's an autoimmune condition, and you want to, if a doctor is suspecting that you have type 1 diabetes, he will order a myriad of other tests as well. And also for gestational diabetes, the treatment differs. So now, what are the complications of diabetes mellitus? The complications are bad, so you don't want to even go there. But the complications are, if your sugar is not maintained for a long time, it eats up at the blood vessels. It damages the blood vessels. They slowly nicks away at the blood vessels. So you can have microvascular or macrovascular complications. So macrovascular is nothing other than large blood vessels, and microvascular are small blood vessels present in different organs. So your microvascular complications could be retinopathy, could be nephropathy, could be neuropathy, which are, retinopathy is of the eyes. So you can have diabetic retinopathy, and that could lead to blindness, amongst other complications. You can even have cataract and glaucoma. You can have diabetic nephropathy, which can lead to things like basement membrane thickening and glomerular sclerosis and mesangial proliferation. So these are also a little bit, you probably won't understand them, but all of these things can lead to end-stage kidney disease and can put you on lifelong dialysis. So, if you don't control your condition. So, and diabetic neuropathy is nothing but it's damaging the nerves. And so that comes in a glove and stocking pattern, where you will feel paresthesias and numbness or excessive pain. So this is why when you hear the term diabetic foot, right? You hear the term very commonly. It's because you lose sensation in your foot. So when you do get an injury, you will have very poor wound healing, and you may not even notice the injury, and that injury progresses and progresses and progresses because you have no feeling, and finally it's infected. And since you have a predisposition for peripheral arterial disease as well, you'll have low oxygen to that area, and that area can get gangrene, and you have to amputate the lower limb. And if you amputate, amputation is 30 times more higher in diabetic individuals than non-diabetic individuals, amputation of the lower limb. So be very careful unless you want to lose a limb. You can control this before it gets there. The macrovascular complications are, of course, myocardial infarction, coronary artery disease, stroke, and some of those, and peripheral artery disease, like I said. So you really want to treat this condition before it gets there, and you can treat it. You can treat it by diet, lifestyle, and exercise. Be active during the day. Do not lead a sedentary life. Exercise, your cardio, aerobic exercise, along with resistance training and weight training. A combination of these 30 to 60 minutes every day can really help. And something that's shown to really help is intermittent fasting. So you need to be in a calorie deficit. You need to increase your fats actually, and reduce your carbohydrates and sugars in your diet. You also need to be in a fasting state for a long period of time, and this is really shown to reverse diabetes, and in a matter of weeks. So it can actually cure diabetes in a matter of weeks. So there's a doctor who specializes on this. His name is Dr. Fung, and he's a nephrologist specializing in intermittent fasting for diabetes. So if you would like, I can send you that link, and to read more about and know more about intermittent fasting in diabetes and how it can cure the problem. Because the problem is not high blood sugar we're treating insulin resistance. And the more drugs you give, the more and more that the insulin resistance does not improve, because we're treating, it's like when you have an infection of the foot. If you treat the fever, not the actual cause of the infection, with antibiotics, you're not helping the cause. You're just elevating the fever. So you need to really treat the insulin resistance, and that is by calorie deficit, and exercise. Of course, for type 1 diabetes, insulin is required, and yoga really, really helps. Meditation and yoga for type 1 especially, but of course also for type 2 diabetes. So there are pharmacological treatments, but I would suggest trying non-pharmacological treatments if your blood sugar is, of course, maintainable. If you're already on a high level, then do both, and try to always you can really reverse it yourself, and you can cure it, in fact. We've seen a pattern of you're giving one medication, and then over time you need to give more medication and more medication, and you have to be on insulin. So if you're not making lifestyle changes, so please go ahead and make those lifestyle changes so you can get off all those medications. So I'm not going to go too much about the medications, but they're oral hypoglycemic agents. For example, metformin, sulfonylureas, and SGLT2 inhibitors and DPP4 inhibitors and GL2. So there are a lot of drugs that are available you can talk to your physician about, and of course insulin. So insulin is used as well, and that's always used in type 1 diabetes, but in type 2 diabetes can be used as well. So I hope this helps you, and if you have any questions, please let me know. Thank you.